One Eastern Kentucky hospital says it has to furlough employees to keep things running. This as some healthcare providers reopen their doors for the first time in weeks.
Warmer temperatures and a few clouds move in as we head into tomorrow. I'll have your forecast now at 4:30.
Floyd County health officials have confirmed a Food City employee in Prestonsburg has tested positive for COVID-19. We are told that person is self-isolating at home. The patient worked there at the deli on Saturday, April 25th, only one day. Anyone who came in contact with that person should self-monitor for symptoms. Food City says it has thoroughly cleaned and sanitized the entire store. And we've just learned of another positive case related to the Jackson Manor in Jackson County, a staff member there. That brings the total number of cases in Jackson County to 58, and most of those are related to that nursing home. As furloughs happen across the country, one specific sector seeing these is hospitals. WYMT's Madison Pergram tells us about a local hospital's decision to furlough some of its employees.
Pikeville Medical Center announced Friday they would be furloughing some of their employees.
Everybody is still on our payroll. In essence, it's a hiatus. We told them to go home, and we will call you back.
Donovan Blackburn, CEO of PMC, says they try to keep their employees working in case of a COVID-19 surge. But with the lack of elective surgeries taking place and low numbers of patients, they couldn't continue that.
We've got this huge engine over there with no fuel going in. We don't have patients coming in. So when you look at inpatient admissions, right now we are doing half. We are at half of what we were the same time last year.
These employees still on the PMC payroll will continue receiving benefits. They will not lose their vacation or sick pay until they get the call to come back.
When we call, the only requirement is you have to come. It may be on a Tuesday, because if you don't come, then it is considered job abandonment, and you will probably risk losing your plan, your benefits.
Blackburn saying the positions furloughed did not have direct patient contact.
So no nursing was furloughed. No physicians were furloughed. These are all support positions, okay? These are tech, clerks, cooks, housekeeping.
But everyone has a special role in the halls of the hospital.
Our employees are still PMC members of this family.
Looking forward to the day everyone can walk back through the doors of PMC and continue to do their job of serving the community. In Pikeville, Madison Pergram, WYMT Mountain News.
As of now, nearly 80 employees are furloughed, but Blackburn expects as operations ramp up and more surgeries are allowed, employees could be called back as early as next week. We also talked about furloughs during a wide-ranging discussion about COVID-19 with two doctors from Appalachian Regional Healthcare today, and you can see that interview tonight at 7 on WYMT. Today starts phase 1 of medical services reopening in Kentucky, but it does not come without strict guidelines from Frankfort. WYMT's Will Puckett is live from his home with more on one of those services that's back up and running. Will?
Steve, good afternoon. Chiropractic offices were left off of that list called the Essential List when Governor Andy Beshear announced his initial starting of closures. Today, however, they were on the list of items allowed to reopen. The steps they are having to take are somewhat extreme. Employees are wearing masks. At Fugate Family Chiropractics, they're doubling up on masks, actually, replacing gloves after every patient and wiping down every table in the building often in order to start their business again.
It's just basically just a little different, you know what I mean? But we're doing everything we can to keep the flow as normal as possible, and we're just so excited to be back to work and take care of our patients.
Now, some of the other steps that Fugate Family Chiropractic is taking is there's no longer a waiting room. Patients come in, they get their paperwork, sit in their car in the parking lot until it's time for them to come in. Patients are also required to wear masks inside the building, and they are operating under appointment only. Steve.
Surprise, I'm not Steve, but as we talk about today's weather, though, it was absolutely gorgeous out there. We saw plenty of sunshine. We're going to continue to see that, though, as we head into the evening hours. Looking at our UVA-wise camera, really not a cloud in the sky. It was a little bit foggy earlier this morning, but that cleared out pretty quickly, which is made for a gorgeous day. Buffalo Mountain showing plenty of sunshine up there. Maybe just some little clouds over in the sky, but we will see a few more clouds heading into tonight. But for now, we're just going to enjoy the nice weather. Low to kind of mid 60s, especially down into Middlesboro, kind of that warmer spot. 65 degrees, 64 in Harlan, 63 in Prestonsburg, and our cold spot of 59 over into Wise. Now, as we head throughout the night tonight, we are going to continue to see that sunshine. However, those clouds do increase very late tonight, mostly into the overnight hours, and as we head into your Tuesday. And that's because we're also going to add in just a few stray rain chances as we move into your Tuesday, but we will still see that sunshine. Only just a few scattered chances, some clouds in the morning. However, Wednesday into Thursday is when that next system moves in, brings showers and storms and those colder temperatures. But by Friday and Saturday, we see that sunshine return once again. I'll have the rest of that forecast coming up in a little bit.
All right, thank you, Paige. The Centers for Disease Control and Prevention has added 6 new COVID-19 symptoms to its official list. That brings the total number of possible symptoms to 9. Jerica Valtierra explains what this means for testing.
I think the thing that's the most critical is do I need to, or do I need to seek medical attention?
That's the question people should be asking themselves if they have any of the coronavirus symptoms. On Sunday, the CDC announced new additional symptoms, which are chills, repeated shaking with chills, headache, sore throat, muscle pain, loss of taste or smell. Dr. Paul Schultz, an epidemiologist at Norton Healthcare, says these are symptoms they've known about for weeks and have been vetting as patients come in.
For the most part in our inpatient program, if a provider thinks that they need to test a patient, then we test the patient. That's our criteria.
Baptist Health Director of the Medical Emergency Department, Dr. Thomas Davis, says people need to know when they should go in.
Then being tested is, from a medical perspective, not the most important thing. The important caveat, though, is what we've learned is that people can get worse very quickly. So if you start getting short of breath, or if you start developing chest pain, you need to be seen because we want to make sure we get on top of it early. Even though
the list of symptoms has grown, Dr. Davis says people shouldn't be fearful about being out in parks or on walking trails.
At the end of the day, it all comes down to what is the risk of certain activities. So being in a closer setting with other people, certainly much higher risk. Going outside for a park where you can get rid of some of that cabin fever and enjoy the beautiful outdoors during the springtime, that's very low risk.
Dr. Davis adds there's not much support that the coronavirus can be contracted through particles in the air, but still to maintain social distancing.
The World Health Organization says there's no evidence that people who have recovered from COVID-19 are protected from reinfection. South Korean health officials found 268 patients tested positive after it was thought they had recovered. Similar stories are popping up across the U.S., especially among healthcare providers. Now experts believe that people with more serious symptoms, including pneumonia, may have a short period of immunity from the virus, though people with less severe symptoms could catch the virus again in a shorter period of time. France reported the lowest coronavirus death toll since March 25th on Sunday. The French health agency said 242 people died from COVID-19 in that 24-hour period. Nearly 23,000 people have died since the outbreak started in that country, including more than 14,000 in hospitals and 8,000 in nursing homes. In addition, the number of coronavirus patients in French intensive care units has also declined, although the amount of patients is still high for the intensive care capacity. Coming up on Mountain News at 4:30, we look at one type of loan financial experts say you should stay away from if possible.
And we'll see warmer temperatures heading into tomorrow. Rain chances return by the middle of the week, but we do see sunshine by the end of the week. I'll have the rest of that forecast coming up.